Today, we're cracking a classic dermatological case. Let's dive right into this skin mystery. It often starts with a patient describing these intensely itchy, shiny purple bumps on their hands and feet.
So what's actually going on here? To solve it, doctors look for a very specific set of clues.
And it all starts with a simple but super useful mnemonic, the 6 Ps.
Let's break them down. These are the 6 key signs that basically give the whole thing away. What's interesting is how these show up together. The bumps are flat or planar and have this deep purple color. They also have this weird irregular shape. And crucially, they're pruritic, which just means super itchy.
You'll see small individual bumps called papules, or they can merge together into these larger patches called plaques.
But out of all these signs, there's one that's considered the absolute diagnostic hallmark, the smoking gun, if you will.
And this is it, Wickham Striae. You see those fine, lacy white lines? That's the definitive clue.
Okay, so the visual clues are strong, but to be 100% sure, you need confirmation from the lab.
The diagnostic process really boils down to 2 key steps, a virus screening and then a close look at a skin sample.
Now, screening for hepatitis C is so important because, for reasons we don't fully get, there's a strong link there. The skin biopsy is the final piece of the puzzle. Under the microscope, you see this unique sawtooth pattern.
So once the diagnosis is locked in, the treatment plan is pretty straightforward and effective.
It's usually a 2-pronged attack, a topical steroid for the rash and oral antihistamines for that crazy itch.
And those antihistamines are key because they stop the itch-scratch cycle that causes something called the Koebner phenomenon.
But wait, the investigation isn't quite over. There's one last, really critical place the doctor needs to check.
And this number right here is exactly why that final check is so important. We're talking
A full 50% of people with Lichen Planus also have it inside their mouths.
This oral version looks like a similar white lacy pattern on the cheeks. And yeah, it can be painful.
This is why regular monitoring is vital. The risk is small, but over time it can develop into oral cancer.
It's a powerful reminder, our skin can be a window to our internal health. So what's yours telling you?